Good morning.
Good
How you
morning.
doing today?
I'm good.
And who are you?
My name is Peter Lee.
Yeah. And Peter, when you were what were you doing in 1964 when I was 5 years old?
I was a dental technician
In what city?
in New York City. Well, I
In
worked,
Manhattan or
no,
Brooklyn?
I worked in New Jersey for George Taub Lab.
Really? And they were a big lab, right?
They were one of the best.
Prestigious labs for all the prosthodontists in Manhattan?
Yes.
Uh-huh.
And while I was there, I did.
It was very primitive at that time. You
Yes.
realize it in respect to what we're
we
doing today?
didn't have implants or anything in those
Right.
days.
And what you were doing? Gold work, PFMs, pasta gold, double
Yeah.
coping stuff?
Bridges,
No
porcelain, gold.
such thing as an implant then,
No
right?
implants.
Right, right. And who was your most famous person that worked that you did work on?
Elizabeth Taylor's husband, Eddie Fisher.
Eddie Fisher. Eddie Fisher. And who was Eddie Fisher? Everybody out there, who is Eddie Fisher married to? Edie Gourmet. And who else?
And then Elizabeth Taylor.
So he went up like from Edie, he went to Elizabeth Taylor. So that's a major step up. Yeah. And do you remember what his dentistry was like there, Eddie Fisher's?
Well, I built the two centrals, two laterals, two cuspids.
In porcelain fused to gold, right?
Yes.
Gold then, right? You were doing gold then,
Yes.
right? Everybody's only doing gold.
Gold.
Still the best,
Yes.
the standard,
Yes.
right?
No. Yeah.
Still the standard, right?
Yep.
Right. If done well, it could last decades for the rest of the patient's life,
Yes,
right?
and of course George Taub used to have, he did all the shading. He would have the patient come to the lab, shade to make sure that he's shaded it correctly.
Where was George, like how did they start the business?
George Taub is in the porcelain business. He sells dyes and different things.
Were they Holocaust survivors? It sounds like
He is.
they were Holocaust
Yeah.
survivors.
Two
Wow.
of the guys working in that lab that do the porcelain work.
Yeah.
They
On the
have-
teeth, for
yeah,
the teeth.
They have their numbers on
Yeah,
their
wow,
arms.
that's powerful. Wow.
Yeah.
Wow. That must have made an impression upon you.
Oh, of course it did. Yeah, yeah.
Nice people, I
Oh,
suppose.
no, yeah, very nice.
Very fine
Very
people,
nice.
right?
Yeah,
Nice.
yeah.
Nice. Wow, how many people
Yeah.
worked at George Taub Labs?
There was about 9, 10 people. Yeah.
So a small lab,
Small lab,
by
yeah,
today's
yes.
standards,
Yeah,
anyways.
yes.
But very, very.
Yes, because there are labs that
Right.
I went to just to be interviewed and so forth to see how the setup is, and they have like 30, 40, 50 people in there working. You know?
Right, right, right. Today's labs are
huge.
multi-levels with departments and stuff like that. Yeah, nice. So, anyways, so you're a lab technician. That's the thing. Like,
Yes, I am.
so you understand the crap that I'm doing physically for you, right?
Your technical side.
Right. So if we look at the Panorex here of Mr. Lee here, we can see all the dentistry that's in his mouth. And just starting from the left side of the screen, the upper right second molar. So we've got an amalgam here, we have a post and core with a root canal with an old crown here. We have a 1x4 bridge here going from a premolar to a central tooth. We have a filling on a central. We have an implant. We have a filling. We have a filling. We have endo, post-core crown, endo, post-core crown. We just finished actually an apicoectomy on this area here. That's doing just perfectly fine. We have an old 3/7 amalgam here. We have a crown here, but there's a boo-boo underneath here. There's a little leakage underneath the crown, and there's a problem in the root here. So we're going to have to figure that out. Then there's some missing teeth here, a whole bunch of worn down teeth here. 2 fillings done by me years ago, doing really nicely. An amalgam that's probably 15 or 20 years old down in this area here.
Yes.
This is a piece of art still. There's nothing to do in this mouth. You had a filling here, some decay here that I did a deal on, and I don't remember what I did on this too. So actually everything is doing unbelievable. Unbelievable. So this is everlasting. To tell you the truth, this is everlasting old dentistry done at a lower level of craftsmanship, but it's still working perfectly fine.
Yep. Yep.
The ceramics, there's no metal anymore. It's all porcelain,
yes.
right? It's all porcelain, tie-based porcelain. That's the way to go. And it's simple, it's more accurate. But let's take a look inside and just see what we have in here, okay? All right, so we'll start from the upper right side. So there's a nice filling in there, a DOVL, MOVL, 1.5 crown post and cord. This is really old stuff. Here's this beautiful bridge. Look at this. From 1.1 to 1.4 with 2 Pontics. Would anybody know that this guy has a bridge in his mouth? Looks really, really pretty. Then we're going to go to an MIDVL. Here's my implant here. Here's a 2-3 with a class 5 at the neck of the tooth. Here's a class 5 with a DOVL. A crown here. Here's my apico. This is about 2 weeks now. If you look on my other YouTube channel, I have apicoectomy. This is a healing apicoectomy. This is only 2 weeks. It's virtually pink up there, so that's doing really well. And an old porcelain fused to metal crown, old technology that's doing well. Here's an old crown here, filling here. This is the tooth with the boob underneath, so we're going to figure that out, and the rest of the dentistry down in here. Just as a little interesting thing here, I want to show you something really pretty in dentistry here. So here's my amalgam here. This was a MOVL amalgam. I put some nice anatomy here years ago. Just needs to be polished, but he had decay here, and I did a resin lock in here. So look at my lock shape. So pretty. See? In. So it doesn't move that way, and it's perfectly smooth. That interface, look at that. There's no bump whatsoever. I don't know how old that is. That's about 10 years old. So really nice to see that. Okay, good, perfect.